So for a total hip replacement, patients often wonder what exactly is going on and what to expect. So a total hip replacement is done mostly under a regional anesthesia, just freezing from the waist down and then giving a good sedation so that the patient doesn't hear anything or really remember anything from the procedure. But the big advantage is that they're breathing on their own the whole time. It's not a general anesthesia most of the time. Hip replacement, make a small incision. There's different approaches, and really I like to tailor the approach to each patient's x-rays and anatomy and what their expectations and function are. Usually an incision for me is about this big, about the width of a hand, and as large as it needs to be to get the implants in perfectly. The surgery takes about an hour to an hour and a half, and essentially what we do, and here's a little model to explain, is we remove the damaged head, and we put in an implant that's perfectly sized for the anatomy of each patient. And I do this with the preoperative x-rays. We have special software so we can plan out to restore the hip biomechanics as best as possible for each person's anatomy. And this implant is usually pressed into place, and it's either held by bone cement or a cementless titanium implant where your bone grows into it. And in the beginning, right after surgery, if you pulled on it, the implant could come out. But over the course of 3 months, the patient's own bone will grow into the implant, and you won't be able to take it out. It becomes fixed. Then there's a large ceramic head, which becomes the new ball. And similarly on the acetabular side, on the socket, you have a titanium cup with a special plastic where this ceramic ball articulates with the plastic bearing, and those bearings have improved tremendously over the last 20 years, and they no longer wear out as quickly as the old bearings. And that is a total hip replacement in a nutshell.